Our state laws prohibit us from advertising the exact cost of any of our services. However, what we can say is that for about the cost of your normal insurance copayment per visit, you can receive spinal decompression treatment in our office. If you have been quoted prices in hundreds or perhaps even thousands of dollars for care from other clinics, this could be for several reasons. First, when spinal decompression first became available, the decompression tables were very expensive, some costing in excess of $100,000. Doctors who chose to purchase these expensive machines soon found themselves having to charge high rates just to recover their costs, and this of course was passed on to their patients. Another reason is sometimes these other clinics may group other treatment services together to arrive at this higher price. And finally, spinal decompression therapy is relatively new, and a fair price has yet to be determined by insurance companies. Therefore, there currently is no guideline as to how much one should charge. But our philosophy is simple: make spinal decompression therapy affordable to everyone. People ask this question all the time, and there is no one-size-that-fits-all type of answer. Typically, the number of treatments depends upon the number of discs you have injured. Treating one injured disc is certainly going to take less time than if 2 or 3 were injured. Also, the severity of the injured disc will also affect the number of treatments. Treating a simple disc bulge is a lot easier and faster than one that has completely herniated and ruptured. But on the average, if you have one disc that is injured, it can take anywhere from 18 to 28 treatments to pull the contents of the nucleus pulposus back where it belongs. Now, each treatment takes about 25 to 30 minutes to complete. There is no pain associated with the treatment. Many people usually fall asleep or watch TV while the therapy is being performed. Some people may feel a little better after their first treatment, but this is rare, and we certainly don't want to give the impression that this happens for everyone. But usually, most patients begin to notice a reduction in their symptoms anywhere between the 15th and perhaps 20th treatment. The important thing to remember here is to be patient with your care. We certainly understand the desire to want your problem to go away as fast as possible, and if there was something we could do to make it go away quicker, we would. But the best we have been able to do is to see a rather significant reduction in symptoms somewhere around the 15th or 16th treatment. It is not unusual, though, with people who are still actively working, that they wouldn't see results up until around their 20th treatment. But in the end, if we are able to avoid you having to undergo surgery, which we have been very successful at, then the number of treatments becomes irrelevant. And that is what we have found to be the patient's biggest concern. At a minimum, get a second opinion. Remember, surgery, whether it is successful or not, is permanent. Plus, there are a lot of things that can go wrong during an operation. If the doctor accidentally nicks a nerve, you can get paralysis in your arms or legs, you can lose feeling in your arms or legs, and a lot of times there is so much scar tissue that develops from the surgery that your symptoms can actually get worse. So, if you are about to have surgery, you owe it to yourself to get a second opinion. With spinal decompression therapy, there are no side effects. Either it works for you or it doesn't. And over the past 4 years, since we have been doing this, we have been seeing about a 75 to 80% chance of success. So there is a very good chance that you'll benefit from our treatments as well. The answer to this question is yes. There is a very high index of satisfaction that patients have even long after treatment has ended. Most people remain asymptomatic indefinitely. If your case is very serious in the beginning, you may need an occasional session or two every month or so just to keep the contents of the disc in their proper place to prevent your symptoms from returning. Most of the patients who have been in to see us have called us back months later stating they are still pain-free and are doing very well. Because this technology is so new, many doctors do not even know it exists. It takes a lot of time and effort to learn about new things, and many doctors are either not interested or they do not have the time. Also, medical doctors are conditioned to either write you a prescription for your back problem, and if that does not work, they recommend physical therapy or perhaps surgery. And if you are taking prescription medication for a back problem, consider this. You are trying to correct a mechanical or structural problem, that being the herniated disc and the compression of the spine, using a chemical solution, and that being the medication. There is no way medication was ever intended to correct this type of problem. It was designed mainly to mask your symptoms. Now, let's also mention that unfortunately, there are financial incentives to perform surgery, and this is not good either. The average back surgery today costs well over $20,000, and it would be hard not to think that it is at least some sort of motivating factor in a doctor's decision to recommend it. We have a lot of patients come into our office who fall into this category. And once we know if a patient has had surgery, the first question we ask is, were there any metal screws or reinforcing rods placed in their spine as a result of the surgery? The reason we ask this question is because if two vertebral segments are now surgically connected with metal rods and screws, then there is no chance of ever separating these two segments apart, which is what spinal decompression does. It decompresses the disc by pulling the adjacent vertebrae apart in opposite directions. Now, if they answer no to this question about there being metal in their spine, the next question we must ask is, were their vertebrae fused together? Such as when the surgeon takes bone marrow from the crest of their hips and inserts it between the vertebrae, stimulating new bone to grow or bridge between the two segments. The net result is similar to that of metal screws and reinforcing rods. The bones are no longer able to be separated. If, however, you have had surgery, but there has been no fusion of the vertebrae, then chances are good that you can still receive spinal decompression therapy in our office. If you have a copy of your MRI or CAT scan, be sure to bring it with you for your consultation, and we will be glad to review it with you, along with all of your other treatment options. Most all of the cases of people who have spinal decompression therapy done still work, but there may be some isolated situations where the kind of work you do may interfere with your treatments. And this all depends on the type of job you are doing. Now, if you are in construction or any other physically demanding job, it may be a good idea to see if there's a way to still remain at work, but perhaps take a less strainful position while you're undergoing therapy. Certainly, we will do our part to write any reports or perhaps letters to your employer explaining your situation and the need for such a change in your work responsibilities. Spinal decompression therapy is covered by most insurance companies, workers' compensation, and personal injury or auto accident claims. You may have heard otherwise. However, spinal decompression is a specialized form of traction, and this is why it should be covered on your insurance policy. Knowing this is why we are able to make it affordable to most patients who seek our services. In the event that you do not have any of these types of insurance coverages, payment arrangements can be made through our office. Again, our goal is to make spinal decompression therapy affordable to everyone.